Is IVF uniquely expensive or is it uniquely undercovered? First, if you've been through in vitro fertilization and it felt overwhelmingly expensive or financially crushing, that's valid. It's very costly when you pay out of pocket because IVF is high-tech medicine. It includes injectable hormone medications that costs thousands of dollars per cycle, intensive lab monitoring, a surgical procedure with anesthesia, embryology labs that run 24/7, high technology cryopreservation and safety systems, and highly trained medical and laboratory staff. That all costs money. But here's the part where we need to separate. Is IVF expensive because big fertility is manipulating vulnerable patients? Or does it feel expensive because insurance often doesn't cover it? If cancer treatment, organ transplants, cardiac surgery, joint replacement weren't covered by insurance, patients would be looking at bills in the tens or hundreds of thousands too. They don't feel as expensive because insurance absorbs most of the costs. Infertility is a medical diagnosis, but fertility care has historically been categorized as elective, largely because when employer-based insurance systems were built, IVF didn't exist yet, and coverage never caught up. Politicians absolutely play a role in whether that gets updated. So when a lawmaker talks about IVF but spreads misinformation about how it works or frames it in a way that creates fear, that doesn't expand access. If anything, it risks making coverage and regulation more restrictive. But politicians are often driven by fertility care sitting inside larger political debates about reproduction, abortion, contraception, embryo status, and family building for same-sex couples and single parents. They're also driven by employers and insurance companies that don't want coverage expansion. So when it comes to access to care, families don't need fear or misinformation. They need evidence-based policy and coverage that reflects modern medicine.